Hi, I'm Dr. J. Bianca Roberts, and welcome to Black Health and Society 101. I'm so glad that you're here with me, and I hope that you will stay as we take a deep dive into the social and political determinants of health that have shaped our health outcomes. I felt that this course was important to put together as there's such an attack on all of the work that's being done to highlight the need to understand diversity, equity, and inclusion in our community. From a health and healthcare standpoint, the loss of this body of work will make our community sicker. So, for the course, each week we'll have a 5 to 15-minute lecture or guest speaker. You'll have to check out the course syllabus that I posted in a previous post to see what's in store for you. Then, at the end of the lecture, the homework assignment will be posted. It will be a reflection question where you can answer directly on the comment section of the video, or you can stitch your own video response. Let's get started. Today, we're going to go over some key definitions and then we're going to put it all together in an example. I wanted to point out that these are the two main books that I'll be using throughout the course. First is The Social Determinants of Health and Health Disparities by Paula Braveman, and the second is The Political Determinants of Health by Daniel E. Dawes. For our first definition, we have health disparities. So health disparities are differences between the health of populations and measures of who gets the disease, who has a disease, who dies from the disease, and who experiences complications from the disease. So it's important to understand that there's a difference between health and healthcare disparities. Healthcare disparities are really looking at the differences in how people access healthcare, experience, or receive healthcare. So, for example, someone who lives in a rural area may experience a difference in how they access care to someone who's living in a city. Now we're going to talk about just a few examples of health disparities that many of us may already be familiar with, but one being the differences in hospitalization rates and death outcomes by race during the height of the COVID pandemic. Many of us may be very familiar with all of the research that has showed the differences in outcomes for Black maternal health and Black infants. In particular, Black women experience higher rates of maternal death, regardless of their access to income, their access to healthcare, their education level, and also we see differences in outcomes for Black infants. And this picture just outlines just a couple of other cancer related disparities that you might see in health disparities. And for the Black community specifically, we see that Black men have a 111% higher risk of prostate cancer, from dying from prostate cancer, and Black women have a 39% higher risk of dying from breast cancer. Okay, so now a lot of people started to wonder, well, why do we see such differences in outcomes for, why do health disparities exist? And this is where a lot of the work for social determinants of health came about. And it's important to understand what social determinants of health are. So first, they are community-wide social, economic, and physical conditions which we experience where we are born, where we work, live, play, and age. It has to do with everything that's around us. So it can't just be that by chance, by genetics, that Black people have these health outcomes that are different. So there's got to be more to it, and that's where social determinants of health come into play. So our social determinants of health, basically where we live, work, play, and age, can be further classified into factors that really impact our health outcomes. These other factors, when we break them down, are influenced by other external factors. One example would be like racism, how we experience education, our access to transportation, employment, our access to food, our access to clean environments and not being exposed to toxins, our access to housing and safety. All of these things impact our health outcomes. And that's what social determinants of health are. A well known example of how a social determinants of health impacted outcomes in our current today would be the exposure of lead to people, to children in Flint, Michigan. So we know that any level of lead is not safe for kids. It's not safe for a developing brain. However, just because these kids lived in Flint, Michigan, and the water was not safe to consume, these kids will have or and are having several health issues as a result of where they live. We're going to see the impact of this over the years to come. Right now, there's a lot of research that's going on that's really measuring and accounting what's been happening to all of these kids that were exposed to toxic water during their early life. So that would be an example of a social determinant of health. Now, social determinants of health are easier to talk about because it's just wow, these bad things happen. It's really unfortunate that this community has experienced this, and we understand the health impacts of it, and let's try to address those health outcomes in those populations of people. But what we don't really like to talk about, which is really important, is the political determinants of health. So essentially, the way that we can think about it is what is the cause of the causes, right? The causes being the social determinants of health, but what causes the social determinants of health? And that's where political determinants of health come into play. Political determinants of health, they really involve the systematic process of structuring relationships, distributing resources, and administering power, operating simultaneously in ways that mutually reinforce or influence one another to shape opportunities that either advance health equity or exacerbate or worsen health inequities. Meaning, how our communities are put together, how they're structured, how we get to live, where we play where we play, where we work, what political factors are leading to that, causing social determinants of health. There are three parts to political determinants of health. They are voting, government, and policy. So, first, voting can directly impact our health outcomes. For example, your community may vote to approve more parks or walking paths in your neighborhood, or maybe on a larger scale, we in a state might ban smoking in restaurants or smoking in housing complexes. That would be things that impact our health outcomes directly. From a government standpoint, the next arm, government really allows decision makers to enforce, keep, revise, or create new policy. And that's how that contributes to social determinants of health. And then policy essentially codifies the decisions that are being made. All of these three parts are impacted by a variety of factors, with advocacy being the overall influencer of political determinants of health. And that's what's outlined here in this diagram. So now we talked about some definitions. Let's just put it all together. Let's start off with something straightforward and common, diabetes, right? What is diabetes? What causes it? And how do these factors that we talked about come into play? So I'm a doctor, so we're going to do a little bit of medical stuff first. So what is diabetes? Well, diabetes has to do with blood being in your sugar at a higher level than it should be. If you look at this picture here, this is a picture of a blood vessel. In the blood vessel where our blood flows, there's different kinds of blood cells, red blood cells and white blood cells. Red blood cells carry oxygen to your organs throughout your body, and the white blood cells are the cells that fight off infection. We also have sugar in the blood, so when you eat something and your body breaks it down, some of that sugar ends up flowing into your blood. Normally, what would happen is when you have sugar in the blood, there's a hormone that's released from the organ called your pancreas, which is in your abdomen. And this hormone is called insulin. It goes and it picks up the blood sugar that's hanging around in your blood, and then it takes it and puts it in a cell, and it turns it into energy that your body uses as energy. But what can happen is when you have too much sugar in your blood, it can cause your insulin to not work very well, or it can cause your pancreas to kind of poop out and stop working. So then you have all this extra blood, extra sugar, which is the glucose here, in your blood. Well, why do we care about sugar being in your blood? Well, unfortunately, when there's sugar in your blood, it makes your blood sticky. It makes it kind of like rocky, like your blood is flowing through a river bank and just eating away at your organs, and it causes problems in all of your organ systems. It causes heart attacks, strokes, um, kidney problems leading to dialysis, blindness, circulation problems leading to needing amputations and things like that. So we really want to keep the sugar down in your blood. Well, isn't the answer simple? Shouldn't we just stop eating sugar and then you won't have this problem, right? Well, let's take a closer look. Looking at the model with some of the definitions that we talked about, we're going to go straight to where I grew up in South Sacramento, and we're going to use a fake patient. So let's say I have a patient, and her name is Stephanie. Stephanie is a 37-year-old female who we recently diagnosed with diabetes. She's lived her she lived her whole life in South Sacramento, and her parents have diabetes. Her grandparents have diabetes. They also grew up there too. So Stephanie's like, wow, I have diabetes too. Everyone has diabetes. You just get diabetes. Well, let's look at where Stephanie grew up, right? So in her neighborhood, there are several fast food places, several, like like five on the same block, but there's really no grocery stores with fresh produce in her area. At one point, her community and her neighbors, they were trying to put together a community garden, but the garden that they started was pretty much destroyed, and the community members were not granted a permit by the city. They didn't grant the community garden permit, so they couldn't do that. So no to the produce. When Stephanie decides that, hey, you know what, my doctor said I need to exercise more to try to get my blood sugar down. Well, if you look at her neighborhood, the sidewalks are uneven, and she's almost fallen a couple of times because it's really uneven. There's some telephone poles right smack in the middle of the sidewalk. And then on the areas where she would take a walk, the speed limit for those roads are really fast. And sometimes there's accidents, and it's just not a safe place to just walk around. And then looking in her neighborhood, there aren't a lot of parks, so you can't just walk around the park. She's not able to do that. So that impacts her ability to do some physical activity that might help manage her diabetes. Stephanie also doesn't have a car, so she rides to work with a friend. And then, unfortunately, if she wanted to go to a store that maybe had fresh produce outside of her community, it would require her taking a bus after hours, and the bus route pretty much stops early evening. So if she doesn't get home before a certain time, then she would not be able to take the bus. So that impacts all of those things that would help her make an easier, better decision to just eat better, right? So living in South Sacramento definitely is a social determinant of health, not having that access. But what are the political drivers for that cause these social determinants of health? Like, why are there no parks in her community? Why are there no safe walking paths? And who decided what the speed limit is on that main street that's near her house? And why can't the community get a permit for the garden? Who decided that? And why are there so many fast food options available in the community and no grocery stores? I remember when I was in undergraduate, I went to UC San Diego, which is in La Jolla, and their city has an ordinance on the number of fast food locations per so many miles. They've made a commitment in their community to really restrict and limit that. So those are some of the things. These decisions that were made were not her choice. And it makes it very difficult to eat healthy and be healthy when the access to healthy options is not so straightforward. It's not so easy. And here's like another thing to think about is, why is there so much processed food and unhealthy food available in the convenience stores or wherever she's getting her groceries? Or yeah, and we kind of have to take a step back and look at another political driver, and that is something that the government did years ago. Essentially, during Nixon's presidency, America was facing a, a big challenge when several young people would sign up for the military. They were deemed unfit, And it was found that there was so much hunger going on in America, that so many people were malnourished, that they were not fit to serve in the military. So then Nixon and his administration reached out to farmers in America and basically set up a system to subsidize corn. Corn began to be fed to the livestock, and it really like pumped up and beefed up the livestock, and corn became readily available to pretty much everybody in the country. Well, we surpassed the being underweight and malnourished because of this, but then the government was still subsidizing corn, and there was just so much of a surplus. They had to figure out, well, what can we do with this? And then someone figured out how we can create and make a sugar, this essentially high fructose corn syrup, and change it into something that can be put into food to extend the shelf life of food, and also it serves as sugar. So we started to see this high fructose corn syrup be placed into snacks and cereals and pretty much almost everything that we see now on our shelves in grocery stores. And that contributed significantly to our obesity pandemic and also increasing diabetes in our country. So that was a political decision that was made but also continued. And these types of foods are still readily available in all of our stores, but we're more likely going to see these kind of options than things that have fresh produce or don't have this high fructose corn syrup in many communities. So that is also a political driver. So we are wrapping up now. What I'd like you to do for this week, our assignment is to again think about the definitions of social and political determinants of health and share how a social or political determinant of health has impacted the health of your family. You can do that by commenting on this video or by stitching the homework video. There'll be another homework post video with this question. And next week, we are going to take a deeper dive into housing, social and political determinants of health involving housing. All right, I'll see you next week.